guys, welcome back to my channel. My name is Becky Cook and we are going to be continuing our path on talking about anxiety disorders, and today we are going to be talking about panic disorder. So the simplest definition for panic disorder is episodes of acute terror in the absence of any real danger. So many people that have panic disorders actually do experience what can be considered to be forms of panic attacks in which they feel actual terror and a need to escape. These panic attacks can have very intense anxiety with them, and most commonly do, as this is an anxiety disorder. So this disorder is really defined by this presence of these panic attacks and how that essentially changes the person's behavior that does have panic disorder. The changes in behavior for many people that experience panic disorder typically surround the worry of having another panic attack, and so they're constantly worried that they're going to get another one and they're not going to know when, how, why, or any of that is just going to happen. So as you could imagine, there could be a lot of different reactions to that, different behavioral changes. You know, if you are afraid to have a panic attack of some sort where you feel terror and you feel genuinely afraid for your life, there's that possibility that, you know, you're going to definitely change your behavior. You're going to change where you go. You're going to change the people that you see, especially when it gets very bad. So I've said panic attack a few times now in this video, and one thing that we should talk about is what exactly is a panic attack. Our society and people use that term almost commonplace, and a lot of times I see people using panic attack when they actually mean to discuss anxiety attacks. A panic attack is kind of similar to this panic disorder. It's very acute times where you feel genuine terror. It's not like, oh, I'm anxious about things, let me clean my house, or anything like that. It's not like panicking over something really small. Like, you are genuinely afraid for your life and you believe that you need help, or you need to go get help, or someone needs to help you. You're genuinely afraid. This disorder usually starts in adulthood. It's usually going to be diagnosed in adulthood, specifically around 20s and after your 20s. But children can also be diagnosed with panic disorders, and many children do experience panic-like symptoms that can be very similar to what people with this disorder experience. When it comes to prevalence, the lifetime prevalence is between 1% to 2% of the US population, and 2% to 3% of Americans experience panic disorder in a given year. Women are typically twice as likely as men to experience panic disorder as well. So next we're going to talk about the diagnostic criteria from the DSM when it comes to diagnosing panic disorder. I'm obviously going to make my blanket statement. Please do not self-diagnose yourself. If you do feel that you relate exceptionally closely to this disorder and you have never been diagnosed, please go see someone, go get help. It gets better. I will have links in the description for places where you can go. There will be crisis hotline links, as well as different organizations that can help you find someone in your area. For you to be diagnosed, you need to have these episodes of panic. You need to have these panic attacks to be diagnosed with panic disorder. That's going to include 4 of the following symptoms: pounding heart, sweating, shaking, shortness of breath, feeling like you're choking, chest pain, nausea, dizziness, a fear of losing control or a fear of dying, numbness or tingling, and chills or hot flashes. People with PD, to be diagnosed, there also has to be consistent, excessive fear that you're going to get another panic attack. So these people are going to be persistently concerned about future panic attacks and worrying about them a lot. On top of worrying about whether or not you're going to get a future one, it's also that worry of the consequences of having another panic attack, in the sense of, you know, where's that going to happen? When's it going to happen? You know, if you are someone that works out of the house and you have to go to some place for work and you have a panic attack at work, like how will that affect you? What consequences will be there for that. And then there's also possibility of, obviously, as I said before, changes in behavior due to these attacks. So it's also diagnostic criteria. If you change your behavior because you have these panic attacks, then it's very, obvious that it's more than just a simple panic attack every once in a while. And lastly, another diagnostic criteria for it is that these panic attacks and forms of panic and worry are not caused by medication, drugs, or any other medical condition. When it comes to the cause of PD, there's no for sure eminent cause of this disorder. As I've kind of discussed in the last video, most of these disorders aren't going to have like a perfect cookie cutter cause to them. But there are obviously some risk factors for PD, and one of them is a family history of anxiety, intense anxiety, or panic attacks. There's also risk factors, and if you have any major life stressors in your life, you're kind of more likely to be diagnosed with PD or to experience it in some form. Some of these major life stressors can come in the form of the death of a loved one. Many people that do have the death of a loved one, it's possible they do eventually experience panic attacks and do experience panic disorder. Another risk factor would be some sort of traumatic event. If anyone has been through a traumatic event, such as a sexual assault or a serious accident, traumatic events can really definitely bring around panic attacks, which we'll talk more when we get into PTSD about that kind of stuff. But panic disorder is also something that's very, very debilitating as well. And so when we have these risk factors where trauma events are a part of those risk factors, there's a possibility where they can have panic disorder as well as PTSD. Some more risk factors could be major changes in someone's life, and that can be bad changes and that can be good changes. A bad change would be something like a divorce or death, obviously, as talked about before. And then a more positive addition could be the addition of a baby to someone's family. Lastly, smoking and excessive caffeine intake also can heavily be risk factors for panic disorder. I'm not going to sit here and say that smoking and caffeine intake directly causes it to any extent, because it doesn't. But if you're smoking, you have excessive caffeine intake, you have a family history of high anxiety already, and on top of that, you've experienced a traumatic event, then it's very possible you could be experiencing panic disorder when you do have these panic attacks and you alter your behavior. In contrast to generalized anxiety disorder, which usually involves chronic, persistent levels of anxiety, people with PD instead experience acute forms of extreme anxiety. You're going to be anxious about everything all the time with GAD. When it comes to PD, you're going to be okay for most of the time, and obviously you're going to possibly worry about a future panic attack, but your anxiety doesn't get extremely high until that instant panic attack happens. These panic attacks often seem to kind of happen out of the blue for many people with PD, but they can actually be heavily caused by stressors in your life. So if you're stressed out a lot, it's very much more likely for you to end up in a panic attack versus if you're not experiencing as many stressors. These panic attacks come on very quickly, and the experience of a panic attack is very, very terrifying for people. They are terrified when they are experiencing a panic attack. It's almost like they feel like they might be in a life or death situation to an extent. It can be that terrifying for people. And with that, obviously, it's going to be extremely overwhelming. But these panic attacks rarely ever last over half an hour. They're usually under a half an hour. So obviously, after that terrifying and overwhelming experience, you're going to be worried about panic attacks in the future of having another one. And with that, it's almost like people with panic disorder get into this cycle of fearing fear itself. When it comes to these people that do suffer panic attacks, their experience of a panic attack can be extremely terrifying in itself. Obviously, panic attacks, you're already like mentally afraid, but they can also have other feelings that are much more terrifying. And so sometimes attacks will bring on bouts of such intense anxiety and physical discomfort for people that they will feel as though they are seriously ill or dying. Obviously, panic disorder, since you're fearing fear itself and you're afraid of the next time you're going to have a panic attack, it can make sense that this is going to affect your daily life, especially when you're afraid that you're going to have a panic attack, which I think panic attacks, when you do have one, it can be very uncomfortable to have one in front of people. So this can interfere with a lot of daily life. Many people with PD, it's common for them to possibly miss work because they're afraid they're going to have a panic attack at work, especially if they're dealing with some high stressors that day or that week. People with panic disorder may also go to like many doctor visits because there's obviously that element of physical discomfort when this happens, so they might be feeling, you know, like they're sick. And then obviously on top of that, they're going to avoid any situation where they feel as though they might have a panic attack. You know, if you think that you're going to have a panic attack somewhere, you're going to avoid that situation in general, and you're not going to engage in it. Many people with PD are also afraid to tell anyone or to share it with anyone. And part of that is they're also being afraid of being called a hypochondriac. So there's definitely, like, on top of being afraid of fear itself, so you're being afraid of yourself and your own fear, but you're also afraid to share that with anyone or to tell anyone or to express the fact that you are experiencing panic attacks, which means that you will probably, you know, they'll distance themselves from their friends and their family. And, you know, they'll distance themselves from the very people that will probably be able to get them help or help find them help or help them get help and support them. So it can be very just hard to live with. For anyone that may be experiencing this, that is afraid to tell anyone, all I can say is that telling someone is going to definitely take a weight off your shoulders. It's going to help you feel a lot better about yourself, and it's going to help you find help to be able to, in some ways, control this disorder and take back your life. So when it comes to comorbidity, one of the biggest disorders that is comorbid with PD is agoraphobia. And agoraphobia is a phobia in which people are essentially afraid of the outside. They don't leave their house. That's the person on that TV show or that movie that you watched that had the fear of leaving their house. That is agoraphobia. And many people with panic disorders develop agoraphobia because, as we said before, you know, they're fearing fear itself. It's that cycle. And if they're afraid that they're going to have a panic attack in public where, you know, you feel as though people are witnessing something extremely intimate, something extremely private, and extremely debilitating, then it makes sense that you might eventually develop agoraphobia and stay inside your home. And you might, you know, obviously go out with a trusted person. Another one is also depression. It can be very depressing for you to experience panic disorder. Panic disorder takes over your life in many ways, and part of depression is obviously the feelings of helplessness. So, you know, and if you're afraid to tell people, you're afraid to get help for fear that people will judge you or consider you a hypochondriac, then there's a lot of helplessness in that feeling as well, and that fear, and it can be very difficult to live with panic disorder. Other anxiety disorders are also comorbid with PD, as well as substance use and abuse. The good news about panic disorder is the fact that there is many places for people to receive treatment for panic disorders, and many different ways for people to receive treatment. Most people with panic disorder will significantly see improvement and a better life. They will have a better life value. They will have so much more than what they had before, especially when they're getting proper therapy and treatment. But we do have to remember that the success of therapy and treatment also varies across different people. And we need to recognize that not everyone recovers fast. Recovery is never linear. So for some people, you know, when they get treated for panic disorder, they may see significant improvement in just a few months. For others, that might take a few years. So when you have these comorbidities, this can make it a lot more complex, as those are also going to need their own treatment. Like if you have depression, substance abuse, other anxiety disorders, agoraphobia, you're going to need treatment for those as well. So it can get very complex for some people with panic disorders, which mean that, you know, treatment can sometimes also be overwhelming for them. And that also means that treatment definitely needs to be tailored to the specific person. When it comes to treatment's going to look like a combination between medication and therapy. Thank you so much for learning about panic disorder with me today. I hope you guys learned a lot about it. If you have any questions about panic disorder, please comment down below. Like, comment, subscribe. Bye guys.